السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا المراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 29 in Maternity and Child Health Nursing and number 68 in Ghaith Review. Today we are going to discuss 5 questions from question number 362 up to question number 366. معاكم محمد عثمان يحيى. نبدأ مباشرة. Question number 362. Interuterine growth curves were used to classify a 32-week-old preterm newborn. Birth weight and gestational age shows the infant growth rate falls between the 10th percentile. What is the priority nursing diagnosis for this infant? The options are number A, risk for injury related to impaired gluconeogenesis. Number B, risk for impaired gas exchange related to meconium aspiration. Number C, risk for ineffective thermoregulation related to lack of subcutaneous fat. Number D, risk for altered nutrition less than body requirement related to increased metabolic needs. وقبل الفيديو هنا اختار الخيار بالشيء صحيح. The correct option is option number C. Risk for ineffective thermoregulation related to lack of subcutaneous fat. اللي اخترنا الخيار رقم C نشوف rational. Small for gestational age SGA infant, especially those born prematurely, such as at 32 weeks, are at high risk for ineffective thermoregulation. This is primarily due to decreased subcutaneous fat, which impair heat retention and immature temperature regulation center in the hypothalamus. So the correct option is option number C, risk for ineffective thermoregulation related to lack of subcutaneous fat. Question number 363. A primigravida woman is assisted out of bed a few hours after normal vaginal delivery. While in the bathroom to clean herself and attempt to void, she reported difficulty sitting on the commode and no air to void. Which of the following intervention is most appropriate at this time? The options are number A, teach Kegel exercise. Number B, give a warm citizen bath. Number C, pour warm water over the vulva. Number D, identify possible perineal trauma. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C, pour warm water over the vulva. ليه اخترنا الخيار رقم C؟ نشوف rational. After childbirth, especially for first-time mothers, urinary retention is common due to perineal trauma, swelling, decreases sensation, pain, and reflex inhibition of the tetracyl method. Pouring warm water over the vulva, a technique called perineal irrigation, helps stimulate the voiding reflex, relax the perineal muscles, reduce discomfort, and encourage urination. So the correct option is option number C, pour warm water over the vulva. Question number 364. A nurse is assessing a young adult pregnant client with no known drug allergies who has tested positive for gonorrhea. Which of the following medication should the nurse expect to be part of the treatment plan? The options are number A, tetracycline. Number B, ciprofloxacin. Number C, azithromycin. Number D, ceftriaxone. وقبل الفيديو هنا اختار الخيار بشيء صحيح. The correct option is option number D, ceftriaxone. اللي اخترنا الخيار رقم D نشوف rational. The Centers for Disease Control and Prevention (CDC) recommends ceftriaxone as the first-line treatment for gonorrhea, including in pregnant individuals. So the correct option is option number D, ceftriaxone. Tetracycline is contraindicated in pregnancy because it can affect fetal teeth and bone development. Ciprofloxacin is not recommended in pregnancy due to potential teratogenic effects and bacterial resistance. And azithromycin was previously included but now is no longer routinely recommended due to raising resistance. Question number 365. A pregnant woman in the early stage of pregnancy presents to the emergency department with leakage of amniotic fluid, vaginal bleeding, and lower abdominal cramping. Which type of abortion should the nurse suspect? Options are number A, missed abortion, number B, inevitable abortion, number C, incomplete abortion, number D, threatened abortion. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number B, inevitable abortion. اللي اخترنا الخيار رقم B نشوف rational. An inevitable abortion is diagnosed when there are signs that pregnancy loss cannot be prevented, such as vaginal bleeding, cramping, abdominal pain, ruptures of the membrane or leakage of amniotic fluid, and cervical dilation. This finding strongly suggests that the body is in the process of expelling the pregnancy and continuation is no longer possible. So the correct option is option number B, inevitable abortion. Question number 366. A 20-year-old prima gravida at 40 weeks gestation is admitted to the labor and delivery unit in active labor. A vaginal examination reveals that the fetal occiput is positioned posteriorly or occipital posterior. Which of the following symptoms would the nurse expect to be increased with this fetal position? The options are number A, leg cramps, number B, back discomfort, number C, vaginal bleeding, number D, nausea and vomiting. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number B, back discomfort. اللي اخترنا الخيار رقم B نشوف rational. In the occipital posterior or P position, the fetal head is facing the mother's front, with the back of the baby's skull pressing against the mother's sacrum. This position commonly causes severe lower back pain and prolonged labor and increased maternal exhaustion. This happens because the hard fetal skull is pressing against the sensory nerves in the sacral area. So the correct option is option number B, back discomfort. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget